Hi, I'm Dr. Jelin Israel-Cvik with the Premier MD Care here in Fort Myers, Florida. And today I want to talk to you guys about stem cells and using stem cells for the treatment of knee osteoarthritis. So I'm sure a lot of people out there have heard about stem cells. I'm sure that because it's been in the news a lot, and perhaps you've even wondered, is it something that you could benefit from, or maybe a loved one could be helped out? And it's really the new frontier in medicine. So I think it's important for us to talk about this. So first question is, so what are stem cells? So stem cells are actually special human cells that have the ability to develop into many different types of cells. So anything from muscle cells to brain tissue, these cells can become anything. And they have the ability also to repair damaged tissue. So that's what we're going to talk about today, is how it's going to help with the knees. So what is arthritis of the knees? So arthritis happens when there is a breakdown in the cartilage in the knee joint. And a lot of people here, especially here in Southwest Florida, as we get older, we have a lot of wear and tear of the knee joint and the cartilage is destroyed. And when the cartilage breaks down, then you have bone sitting on top of bone. And then the bone can then develop bone spurs, further causing more swelling and inflammation and discomfort. So this pain that people experience in their knees from arthritis oftentimes keeps them from being as active as they would like to be. And so this results in atrophy and laxity of the ligaments that hold the knee joint together. So what do we do about this? So there are medications out there that can help treat knee arthritis. That just kind of puts a temporary bandage on the situation, so to speak. There are also some cortisone injections that you can get in there, but again, it's a very temporary fix. It does not repair the cartilage. And in very severe cases, you can have knee replacement, but obviously that's a pretty big surgery, a lot of cost involved, a lot of rehab time involved, not your first choice, obviously. So the one good alternative we have now is stem cell injections into the knees. And this brings up the question, are all stem cells the same? Well, there are two basic different types of stem cells. We have stem cells that we can get from our own fat tissue or from our bone marrow. And then we have umbilical cord stem cells, which comes from the umbilical cord of a baby, a healthy baby that was born. And those cells have been tested to look to see how powerful they are. And they are actually far more powerful than someone who's 50 years old and has stem cells taken from their own body. Those cells have had some damage over time, whereas the umbilical cord stem cells have not. So we use the umbilical cord stem cells to inject into the knee, and this helps to actually repair the cartilage that was damaged. So like I said, those stem cells can turn into anything. So they can turn into cartilage, and they can turn into repairing cells that can repair the ligaments as well in that knee. So this is a great alternative for people who are choosing to do something short of surgery to help with their knee arthritis, to improve the quality of their life, and to keep moving. So getting a stem cell injection into your knee is a very safe and simple outpatient procedure that we do right here in the office, and we can use an ultrasound if we need to make sure we're getting into the right space, but a lot of times we don't have to even use an ultrasound. And the results from the stem cells, you can start feeling benefits within 2 weeks, up to a month, and it's really a once in a lifetime type of treatment per joint. So if you have just one knee that's bothering you, or it's a knee and a shoulder, really any joint that has arthritis can benefit from stem cell injections. So if you have any more questions and would like to come talk to us about the stem cell treatment option for arthritic joints, please don't hesitate to call us, and we'll be happy to sit down and talk to you. Thank you.